Despite being preventable, burn injuries affect tens of thousands of children every year. While the majority might be minor to mild, some are extremely serious. If a child survives, a burn injury could have a lifelong impact, as it may be visible and possibly restrict mobility.
We admit close to 600 patients a year, and bearing in mind that those are patients that have met the admission criteria to a burns unit. So those are your more major burns that need specialist care. Aside from those, we know that most of our burns are being managed in the community or outpatients, and we conduct close to 4,000 appointments a year. So that's not individual patients, but that's the number of consults that we conduct for burns patients. And it really is a significant burden, and we know that in the periphery and the primary healthcare clinics and the further hospitals that are in our province, they are seeing an even bigger number of burns because those are the burns that never make it through to us because they're being managed at home or at the clinic or by whoever's closest to them.
Mendes says the numbers of burn injuries in South Africa are higher than the world average. It affects poor households the most. A vital partner in creating awareness through outreach and education programs is the NGO Child Safe South Africa. Practical advice, such as demonstrated with this candle in a glass jar with sand, can be life-saving. The organization also educates people on what to do if a child has a burn injury.
The biggest thing that you can do in the event of a birth, take the exposed area and let it run under cold water for at least 15 to 20 minutes. If it's a bigger area and you have cling wrap, put the cling wrap around the area and get to a medical facility as soon as you possibly can. But we need to dispel those myths of the toothpaste and the butter and the eggs and those sort of things. It's still happening.
Accidents can happen in an instant, especially with open flames, a stovetop where the child can reach a handle of a pot, or with improper electrical connections. As much as 90% of burns are as a result of hot liquid, including bath water, oil and kettles. Even a warm drink can cause immense harm.
Your skin's a bit thicker, you're a bit more resilient to injury. So if you were to spill a cup of coffee on you, you'd have a bit of a scald, it would be a bit sore, but you'd probably be okay. Whereas in the same injury to a child will result in deeper thickness burns that may require admission to a burns unit or skin grafting or some sort of surgical intervention.
Treatment in the unit can range from at least 5 days to as long as a year. Not only hospitals like Red Cross offers treatment. While prevention is better, getting medical help urgently is vital, and clinics have trained staff to support victims. Referrals to hospitals are based on the nature of an injury. Mariska Botha, SABC News, Cape Town.